While lab tests can be very helpful, drawing conclusions and performing reactive coaching is very risky business, especially if we're talking about a midlife female. Perimenopause does not follow the same rules every month, and hormones don't play fair. This is just a fact of the matter. I'm going to show you what could be happening behind the scenes. Behold, estradiol is in pink, progesterone is going to be in this greenish, tealish, colorish situation. Estradiol in perimenopause, which again can be a 4 to 12 year time period for some women, can actually surge 20 to 30% higher than baseline in reproductive years. Very, very important that as coaches and as females, or as coaches educating your females, you understand this. This can translate to sleep disturbances, heavy periods, etc., and having some wonky looking labs that can send you into reactive coaching, might have you pause. Why can this happen? Because as follicles quantity and quality decline, the message that the brain is sending to them, they're not really picking up the phone today. And then when they do pick up the phone, the brain is like trying to send that text. It's kind of like when you're trying to message your husband and you send him like text number 12 and he has his phone on him at all times, and for some reason he doesn't have it on him right now. Same thing, to which then he's like, hey, like what's going on? Like overzealous. Same thing that can happen here, to which more estradiol production. Also, really important to see here that progesterone between 35 and 50, again, this perimenopause period, can actually decline, or I'm going to say drop off, between around 75%. That is huge. Now, why does progesterone leave the picture? Many different reasons, and can look like many different things. One is lack of ovulation. So if we do not ovulate, we do not produce a corpus luteum. If we do not produce a corpus luteum, or create a corpus luteum, I should say, we're not producing robust levels of progesterone, to which in ovulatory cycles, no ovulation, no progesterone. Other things is we could actually have poor corpus luteum function or quality, which does happen. This is a thing. So you do ovulate, you do create a corpus luteum, but perhaps the quality is not there, to which the amount of progesterone you produce is very low. This can happen from stress, short luteal phases, females that have had surgeries with regards to abdominal surgeries, lack of blood flow, etc. So this is a really important things to take into consideration, especially when you're having conversations with your females. Hormones shift fast, sometimes very slow, arguably the 12 years, and they're not always predictable. So rather than reacting to one set of labs, use them as a starting point. Use them as a way to facilitate a dialogue and education. Track patterns, test again, and then make choices to help empower your clients. Because the goal here isn't to chase numbers, it's to understand the whole picture and empower your clients with that information.